everyone, welcome to today's lecture. Our focus is on a classic yet still clinically used for herb formula, 韩必方, used in the treatment of cold B syndrome. We will explore what cold B is, how 韩必方 is structured, the classical ideas behind it, and how it integrates with modern clinic evidence. Whether you are seeing patients with arthritis, chronic lumbar pain, or cold sensitive joints, this formula gives us a reliable and flexible treatment strategy. Let's start by defining cold B. In TCM, cold B refers to a type of musculoskeletal pain that is caused or worsened by cold weather or cold environments. Patients usually present with fixed cold pain, heaviness in the lips, and stiffness and restricted movement, and symptoms that get worse in winter or damp climate. You may have seen this in case of frozen shoulder, chronic low back pain, or cold damp type arthritis, especially among elderly patients or those with weakened yang qi. On how does model science explain cold B? When the body is exposed to cold for long periods, the blood vessel constricts. This leads to reduced blood flow to the muscles and joints, with less oxygen and nutrition reaching the tissues, with the products accumulate, causing pain and stiffness. Over time, this can result in chronic low-grade inflammation, fibrosis, or thickening of the tissues, and overall reduced flexibility. The end result is pain that lingers and doesn't show up on an MRI, but really limits quality of life. Now let's switch to the TCM view. Cold B is caused by the invasion of cold and damp. These are external pathogens that penetrate the skin and settle into the meridians and joints. If a person's yang qi is weak, especially the wei qi, their ability to fight off this invasion is reduced. The cold stays inside, blocking the free flow of qi and blood, and that's where the pain starts. That's why treatment always includes warming and unblocking the channels to restore normal circulation and drive the cold back out. The classics give us strong guidance here. The Suwen simply puts it, cold causes pain. That sums up the cold B mechanisms in one sentence. In the 金匮要略, warming therapies are recommended as first-line treatment for cold type B syndrome. Later scholars like Chen Shiduo emphasized the need to not only expel cold but also nourish yang, especially in case where the condition is long-term or the patient is elderly. This formed the theoretical basis of 韩必方 formula that both warms the surface and strengthens the core. Historically, cold B was treated with warming formula like 桂枝汤 for mild cold invasion with stiffness, 阳和汤 for cold that has penetrated deeper into the joints and the sinews. But over time, doctors realized that many cold B patients also had underlying deficiency, especially qi and blood deficiency, or even kidney yang deficiency. So modern TCM involve this older prescription into something more comprehensive. Han Bi Fang was created to warm, unblock, tonifying, and harmonize all at once. Here's what makes Han Bi Fang so powerful. It's careful, balanced. Warming herb like 肉桂, 泡姜, and 麻黄 drives out cold. Qi and blood tonics like 黄芪, 当归, and 熟地, 黄 nourish and support the interior. 白芥子 help to penetrate cold phylogen lodged in deep tissues. 鹿角胶, a rich yang tonic, strengthens the kidney yang and help with long-term cold accumulation. 柴胡 is added for regulation and harmonization. Together, they form a multi-layered formula that treats both the branch, cold obstruction, and the root, yang deficiency. Let's break down the treatment logic of the formula. First, warm to scatter cold. That's your 肉桂 and 泡姜. The second, tonify qi and blood to help tissues recovery and prevent re-injury. Third, nutrition yang, especially in chronic or elderly cases. Fourth, harmonize. 柴胡 help prevent internal imbalance. The fifth, and the last, open the meridian. 麻黄 and 白芥子 get things moving. It's a great example of treating both the excess pathogen and the underlying deficiency, making it suitable for long-term stubborn cold bee patterns. Modern research supports many of the herbs in Han Bi Fang. 肉桂 and 麻黄 increase peripheral circulation, warming up the body and relieve pain. 白芥子 act as a local stimulant, improving blood flow and reduce inflammation. 鹿角胶 supports collagen regeneration and enhance yang harmony like yang hormone like activity. 柴胡 plays a surprising role. It can help with the thermal regulation and stress modulation, which matters in chronic pain. So while the formula is grounded in classical theory, it's fully supported by model mechanisms. Clinical trials have confirmed that Han Bi Fang's value. One study showed that Han Bi Fang combined with acupuncture outperformed acupuncture alone in. The first thing is pain reduction, the second thing is joint mobility, and the third is the overall recovery time. It was especially effective for cold arthritis, chronic lumbar strain, and senile B syndrome. What's more, patients using the formula reported better cold tolerance and fewer flare-up during seasonal changes. So the formula doesn't just treat symptoms, it can actually change the disease trajectory when used early and consistently. In clinical practice, here's how we use Han Bi Fang. First, use it when the pain is cold, deep, and worse in winter or damp weather. It's especially effective for conditions like frozen shoulder, cold knee pain, and lumbar stiffness in the elderly. Just a few tips. Please caution with Ma Huang in patients with hypertension or heart disease. For long-standing cases or older patients, emphasize yang tonics like 鹿角胶 and 熟地黄. You can boost effectiveness by combining it with cupping or infrared therapy. It's all about warming the body from the within while moving qi and blood. Let's summarize today's key point. Cold B syndrome Han Bi Fang is a cold dam obstruction, often paired with yang deficiency. Fang addresses both the external cold and internal weakness. It warms the meridians, nourishes the body, strengthens yang, and opens circulation. It's useful in conditions like frozen shoulder, cold-sensitive joint, and stiffness in weak mouth. Clinical research supports its use, especially when combined with acupuncture or warming therapies. It's a smart, well-balanced formula perfect for chronic cold-related pain. When channels are warm and qi flows freely, pain will disappear. This is one of my favorite TCM lines. It reminds us that sometimes the best medicine isn't attacking the pain, but warm the flow, strengthen the core, and restore balance. That's the power of Fang. Thank you for your attention today.